Hi everyone, welcome to the featuring page section of the TBPPM Learning Network. In this section, we will be highlighting innovative projects and interesting practices that is prevalent in the field of tuberculosis. It's a platform to share your work with the rest of the community and also learn from others who are involved in private sector engagement and tuberculosis care. Today we have with us Charles, the program manager in the Institute of Human Virology in Nigeria. He coordinated the teams that upgraded and deployed the MATS app that was developed to ease the process of TB screening and notification by private healthcare providers. In 100 days since the launch, the app has helped in initiating treatment for nearly 260 confirmed TB patients. Let's now hear from Charles. Hi, Charles. Thank you so much for joining us today. Could you
Yeah,
give us
thank you, Clayton.
Yeah, thank you. So could you give us a brief overview of the MATS app?
The MATS stands for Mobile Application for Tuberculosis Screening. Um, the app is used for tuberculosis screening and notification. It runs on an Android mobile platform, providing real-time information through a web interface. It's currently being used by private healthcare providers in Nigeria to screen and notify TB cases.
So what inspired the development of this technology?
In Nigeria, private healthcare providers account for more than 60% of healthcare seeking in country. And this high proportion of clientele provides an opportunity for finding the missing TB cases in Nigeria. So at the inception of the project, the Global Fund Tuberculosis Public-Private Mixed Grant, IHBN and the National Tuberculosis and Leprosy Control Program wanted to develop an app that will be user-friendly, provide real-time and a simplified system of documentation of TB screening and notification in the private sector. The goal was to have a system that will address the challenges of recording and reporting with paper-based system, coupled with the high rates of attrition of human resources in the private sector. So we wanted to develop a technology that will help in closing the gap between TB diagnosis and treatment in the private sector, such that cases that are diagnosed in the private sector are easily tracked and linked to care. So these were some of the key factors that inspired the development of this technology, the MATS app.
What would you say is unique about this technology?
Yeah, the technology is unique in the sense that this is the first time that a mobile technology will be used in the National Tuberculosis and Leprosy Control Program for TB screening and notification in Nigeria. There are several other features about the MATS app that makes it stand out. One is that the technology was developed in Nigeria by Nigerians. So the developers have a good understanding of the environment and the context in which the app will be used. So it's easy to communicate changes in requirements and users' needs to the developers. And users don't need to have a knowledge of tuberculosis management to use the app because the national screening algorithm is embedded in the app so that it guides users when they use this app for screening patients. Another unique thing about the app is that it sends SMS notification to facility where clients are referred to, and also sends SMS to the client that is referred. So it sort of helps to ensure completeness of the referral system. Also, the app has a geotag feature that helps to identify the location of clients that are screened. And this is very helpful because it can help us to begin to identify TB hotspots in the community. And again, I mean, the app also works offline, looking at the kind of terrain that we operate here in Nigeria.
Oh, that's great to hear. I'm sure an app would have had its challenges in during the development process. What were the challenges that you faced during implementing this project?
Yeah, it is not unlikely that a new project like this will face some initial challenges. However, we are learning through the process, and it's helping us to refine the technology and to implement, the process better. The app was launched at the peak of the COVID-19 pandemic in Nigeria. So conducting physical trainings for users was practically not possible. However, we've been able to we're able to overcome this by resorting to virtual trainings. So far, we've trained over 500 users virtually, and it's still counting because we conduct weekly trainings from the HQ. Secondly, poor internet connectivity is a challenge in the use of the app, especially in remote locations in Nigeria. However, because of the offline mode features in the app, this is being addressed. Also, there's this challenge of not all users have the mobile phones to use, especially in the local areas. What the project has done was to procure some mobile phones and tablets and distributed to users. And then we encourage users who have these Android devices to use their own devices to download the app and be able to use it for TB screening and notification.
It's definitely great that it came during the COVID period. So how many
Yeah.
people has the project reached? How many private providers use the project at present?
Yeah. Currently, the app is being used by close to 3,000 active users who screen with the app and also are able to view the screen data through the web interface of the app.
Oh, that's great. And I'm sure you covered this earlier, but could you give us a little brief overview of how COVID has been impacting the project and what steps you've taken to overcome the impact on the project itself?
Yeah, so COVID-19 has had a very great impact on the project. Like I mentioned earlier, the app was developed and was launched during the peak of the COVID-19 pandemic in Nigeria. So we could not conduct physical trainings at the first instance. But like I mentioned earlier, we resorted to virtual trainings through Zoom, and we also used the Google Meet to do some of the trainings from the HQ. And then those who were trained virtually, like the linkage coordinators we have at the local communities that are closer to the providers, now go to these providers and cascade the training. So the training is ongoing. Every week we organize these virtual trainings for users, and also we organize troubleshooting sessions for users on a weekly basis. Secondly, during the COVID-19 period, especially when the peak of it, people were uncomfortable talking about respiratory disease symptoms. So screening patients, asking them about the symptoms that are relating to respiratory diseases. People usually have that, they don't want to mention some of those symptoms. And this affected the number of clients that were screened at the beginning of the launch of the program. However, we're able to do more of mentoring to the users using the state TB programs, using the sub-recipients, and then to mentor users on how to better approach clients when they want to screen them for TB. And that has yielded some good results as we see in the output currently.
So what would be the advice that you would give to our learning network members who want to do similar projects or in
Yeah,
general?
my advice is that one is that we must commit to investing in mobile technology, in finding the missing TB cases, especially in the private sector, as this is key to attaining the NTB strategy. Mobile technology is the way to go. Worldwide, everyone is moving towards that direction, and we have seen it work here in Nigeria through the use of the MATS app. And we also encourage potential developers or people who want to go into this kind of technology to use, to use developers in country, because they'll better understand the system, they understand the terrain, they understand the environment that this app will be used, and it'll be easy to communicate requirements and needs to the developers.
That's great advice. Thank you so much for joining with us today, Charles. It was a really pleasure to hear the experience from you, and I'm sure it will benefit our community members too. Thank you.
Very well, very well. So I want to use the opportunity to appreciate on behalf of the Chief Executive Officer of IHGN, Dr. Patrick Dakun. I would like to express my profound gratitude to the Global Fund for supporting this laudable project in Nigeria. We want to thank the National Tuberculosis and Leprosy Control Program, led by the National Coordinator, Dr. Adebola Lawansi. They have been very supportive in getting this project running, and the successes we are having today also, they have contributed a lot to it. And we also thank Pharmacist team, the developers that also supported us in upgrading this matter for TB screening and application. And finally, my team here in IHBN, who we worked closely to ensure that this app was launched, and they've continued to provide support to the project in meeting the desired goals. Thank you.
Great. Thank you so much, Charles. Thank you.
Yeah, thank you, Clayton.